Every Monday we're focused on different aspects of our health, and today we have Dr. Addison and Dr. Fritz. They are both surgeons from Portneuf Medical Center. So thank you both for being here today. And of course, we're still in October, which is Breast Cancer Awareness Month. So we're talking about all things that people need to know relevant to breast cancer. And of course, unfortunately, people are diagnosed with breast cancer, and that requires treatment. Sometimes it requires surgery. So how is it that someone with breast cancer is determined whether or not they are a candidate for surgery?
So once they make it to our office, we typically have the diagnosis of a breast cancer. And in most cases, every patient that we see is a candidate for breast surgery. It's really just looking at their overall health status to see whether or not they can tolerate the surgery. But in most cases, everyone we see will eventually end up with some sort of surgery. Okay,
and I know it can be, there's a big scare or intimidation factor when you hear surgery and when we're talking about that. But what are some options for breast surgery? Because it's not always a full mastectomy, right? There are some different options.
Correct. So oftentimes, especially if you catch the cancer small, we can do just what's called a lumpectomy or a partial mastectomy, where you take just a portion of the breast. We practice something called oncoplastic surgery, where we actually try to hide incisions and make the breast look as much like it did to start out with as it does after.
Okay, and talk about kind of the recovery time. What can people kind of expect for recovery time if they do have to have surgery?
That's really variable depending on what surgery they end up having, but in most cases, for a partial mastectomy or a lumpectomy, it's anywhere from a week to a couple of weeks after surgery. So in most cases, patients recover very quickly and get back to their daily lives pretty quickly as well.
And how does breast surgery kind of contribute overall to breast cancer being treated or cured for patients?
So breast cancer surgery itself is actually a big core part to treatment of breast cancer, especially with the partial mastectomy. It's what's called breast conservative therapy, excuse me. We use surgery, radiation, and anti-hormonal chemo drugs, a combination of all three to treat their breast cancer. So surgery plays a very big part in all of it.
And you guys as surgeons, as well as other doctors at Portneuf, you guys all work with the cancer center that you guys have at Portneuf with the oncologist to kind of come up with a full comprehensive treatment.
We do, and that's the fantastic part about what we get to do is we work as a team. We approach this as a multidisciplinary team, so we work with, as you said, the medical oncologists, the radiation oncologists, and then other disciplines to help take care of the patient.
Sure. Is there something kind of key or information or anything that you'd like the community to know when it comes to like breast surgery and treatments?
Surgery's not as scary as everybody thinks it is. Most people tolerate it extremely well with minimal pain. It's a great team that we work with up there at the Cancer Center that helps people through all of that as well. So that's quite helpful.
Okay, thank you both so much for being here today. We appreciate you being here.